Our next segment is sponsored by Dr. Daniel Nickles, a resident dentist for the Your Carolina show. Dr. Dan, good morning to you, sir.
Good morning to you, sir.
You look good. That's a new suit, isn't it?
Absolutely.
I already complimented you on your wardrobe. We want to talk a little bit about gingivitis. That's gum related.
Absolutely. Gingivitis is the earliest form of gum disease, and if you're brushing and flossing, you start noticing a little bit of blood on the floss or the toothbrush. That's a warning sign. Anything red, stop, danger.
Right. Just one time, or could that be something you did, or should it be a consistent thing?
If you start seeing it on a consistent, basis, but anytime it shows up, it tells you there's a problem here. We need to address this. You need to see a professional.
What causes it?
Most of it's just bacterial response, or the body's response to bacteria. That sometimes you're brushing and flossing. 28, 32 teeth. Each tooth has 5 surfaces. There's a lot of place for plaque to get caught in there and lost in there. And just with the bacteria sitting there, it actually starts eroding into the blood vessels in your gingiva.
So it's nothing. It's not you're brushing too hard, or.
You could brush too hard, but usually just with a light stroke, everything's going to be fine. If you're brushing too hard, you're bleeding. Ease up, type A personalities, right? But if you start seeing some, pick up your brushing a little bit, start, flossing, 2 or 3 times a day if you can, brushing after meals. I know it sounds like a lot, but those are the things that are going to keep you healthy and keep your gums healthy.
You said it's the earliest stage of gum disease.
Right.
What are the other stages of gum disease?
Well, gum disease, gingivitis is not treated, goes into periodontal disease or, grandparents' pyorrhea, which means, fiery gums. And that's when you start getting, bone loss and tooth loss.
Okay.
So, really?
Yes, absolutely.
So if you don't catch it early.
You don't catch it early, it will progress. And the bad thing is, for most people that understand, is by the time it hurts, it's too late. When somebody sits in my office and goes, now my teeth are really hurting now, haven't been in a few years, that's when you start taking teeth out and you start looking at having to do, implants and dentures, because it is too late to try to save those teeth.
Can you, we catch gingivitis, let's say. Can you stop it completely? Can you reverse it? Can you, what
Absolutely.
happens?
If caught in the early stages from, gingivitis, even early periodontal disease, we can't arrest it and just absolutely stop it.
Okay.
And it's the bone loss that really distinguishes the two between, the gingivitis and the periodontitis. But, if good oral hygiene, frequently, getting your teeth cleaned every 3 to 6 months, right there is the most important thing, in flossing every day. People always want to put floss to the back burner. That's what's going to save you more than anything.
Because that's where the bacteria is really hiding.
It gets between those teeth, absolutely. Yeah. Yes, sir.
Well, you're more than, an implant gum guy.
Right.
You can be the guy that cleans teeth for everybody, too.
We do it all, absolutely.
What are the other things you do? By the way, while I got on that sidetrack, that ADD kicks in every once in a while. What's the best texture of toothbrush? Medium, soft?
Soft.
Soft is best?
Soft.
Thank you. I'm sorry.
And actually, people always want to grab it and brush. And we get in a hurry. Sometimes think the faster the better. Literally, 3 fingers. I always tell people, if you can hold it and it's just the tips of the bristles.
Soft.
Just really just wiping out. You're wiping it off, because when you actually start pressing down, or you see, your brush, is actually frailed out.
Yeah.
You really literally just, you're pushing the bristles out and taking the wipe side of the bristle and you're just wiping it back on your tooth and spraying it around your mouth. So.
Okay.
I think I'm a type A person.
Well, now cover some of the other things you specialize in.
We take care of everything from, just cleanings, fillings, crown and bridge, veneers, implants, root canals, wisdom teeth. You name it, we do everything but braces.
You need a drive-through, so
which is nice because it's all in one place.
It's all in one place.
You need a drive-through, you can drop your teeth off in the morning and pick them up in the
evening. If people would do that, my life would be better too.
Like a bank.
Exactly.
Yeah. Well, of course, every 6-month checkup is probably essential.
That's absolutely essential, but they've actually found, really through research, every 3 months. It's the inhibition and getting rid of the bacteria every 3 months. Actually gives you the best oral health.
Okay.
6 months came from an old Pepsi commercial on the Howdy Doody show.
And
really?
We took it and run.
And we took it and run. See where the yellow went when you brush your teeth with Pepsodent? See your dentist twice a year. And that got locked in.
Well, listen to this guy, not Howdy Doody.
He's not old enough to know who I know who Howdy Doody is. And he had wooden teeth. His head was made out of wood, too. Dr. Daniel Nickles, thank you.
Thank you, sir.
Good to see you.
Good to see you.
Get your green on and get ready to get some happy feet. We're going to run. We got a run coming up, or a walk in honor of St. Patty's Day. I'll tell you about it in a minute.
All right. Sounds like fun. It sounds odd to say it, but Easter bouquets, it's right around the corner. You're still starting to see the Easter candy in the stores and whatnot. Get those flowers going, whether it's for your church function or your dinner table when all the family comes over. AArrangementFlorist.com. You can order it online right now, or you can stop in Greer and Spartanburg, pick it out yourself.